Hi dear friends, this is Dr. Sarabjeet Singh along with Dr. Navreet Sandhu from the Perfect Smile Dental Clinic, Chandigarh. In this video today we are going to talk about a precision attachment which is of great help in cases of patients who are not ready for implant surgeries or in which the sinus is too low and needs an extensive sinus lift procedure. So in situations like this, this precision attachment is very effective, as I'll be showing you in certain cases. So there is a ball and socket joint along with a tooth and tissue bound denture which can be used. Like in this case, there was missing 2.6 and 2.7 and a lower missing molar. In situation, patient was very afraid. She didn't want a sinus lift procedure. The implant surgery was very complicated and extensive. So she went for this procedure. We did root canals for the two premolars, and then we gave this attachment in upper, and along with that we gave a 3-unit bridge in the lower, as you can see. And the patient has been last 3 years has been nicely getting the mastication as well as the performance fine. Another case in which we again gave this attachment along with the ring attachment system, and patient was not ready for the surgery. The sinus was too low. So in such cases, the life of a patient becomes more easier and a non-surgical simple procedure, and it really works. We have a follow-up of around 4 to 5 years for this procedure. In this video we are going to show you how it can be easily removed and inserted.
Hello. So we have given in this patient a Reen precision attachment. Here the implants were not possible, as you can see on the last on the two premolars, and behind that we have given this attachment. And it is easy to remove and place, as you can see here. See, this is the detachment which comes out. As you can see here, extra clasp has been added for retention and quite easy to place back. Patient can do it, you have to give a small training, and you can see a click here, a click. So this was the click, and just close. See.